Hey everybody, welcome to This Week in Global Health. It is great to be back, and this week we're going to be telling you about basically giving you a global health news roundup, the things that we've found interesting in the last week, the last month. And I have a great team here with me to tell you all about it. So, ladies, why don't you introduce yourselves? First of all, I'll say I'm Jessica Taaffe, and I'm coming to you from the Washington, D.C. metro area. And today I'm going to be telling you about a conference, a gathering of scientists on disaster risk reduction.
Hi everyone, my name is Vijoleta Gordeljevic. I'm joining you from Quito, Ecuador this week, and I'll be telling you a bit about air pollution and health.
And I am Marie Onakomaiya, also coming to you from the Washington, D.C. area. I will be discussing recent updates to maternal mental health screening.
Hi, and I'm Sarah Borg. I'm talking to you from the World Health Organization in Geneva, Switzerland. Today I'll be talking about the yellow fever vaccine certificate and some updates related to that.
Great. Sounds like we've got a diverse bunch of stories, but all very interesting for you. So, Vio, why don't you start off? Tell us about the air pollution news stories that you've found interesting this month.
Yeah, so one topic that has received quite some attention this month is air pollution and its effects on health. The WHO, in fact, has described its newest data on air pollution as an health emergency. And the latest scientific research also suggests that nowadays there's more people dying of air pollution than of HIV and malaria combined a year. So this emergency is caused by increasing clouds of smog created by transport fumes, by construction dust, but of course especially by toxic gases from power generation. And according to the UN, there's now 3.3 million premature deaths due to air pollution, most of which are strokes or heart attacks. So you can imagine that the countries worldwide need to prepare for even more increasing numbers of respiratory and heart diseases, and that the future costs for society, and especially the burden that this will put on especially weak healthcare systems, which are usually more affected by air pollution, will just be immense.
So, Via, has anything been done about this yet?
Well, on a micro level, for example, to reduce indoor pollution in homes, there is things that households can do. But you can, for example, you can use alternative fuels, or there are certain kinds of stoves and interventions that organizations suggest. But for many countries, that's just a small part of the problem, right? Indoor pollution. So, because on a big scale, when we talk about fighting air pollution, we kind of talk about fighting climate change. And climate change is unfortunately not something that the WHO can just, fight by putting an intervention out there. So it is political, and the interventions will need to be huge, including big investments in the public sphere, including the move away from fossil fuels and an overall power shift in society, really. So until this happens, all we can do is treat the symptoms and, well, ignore the cause, really.
Thanks, Vio and Marie, for your comments on that. Air pollution is definitely going to be something that we always talk about in the news, and we're going to keep hearing it, especially with the climate change discussions that are going to continue happening in the future. So thanks for bringing that to our attention, and this particular one. Marie, tell me, what have you found interesting in the news lately?
Absolutely. So on January 26th, the United States Preventative Services Task Force, which is a government-appointed health panel in the U.S., issued updated guidelines for depression screening in a publication in JAMA. Basically, the major takeaway and a big change was that they are now recommending that all women be screened for depression both during and after pregnancy. And routine screening during pregnancy is a significant change and actually reflects recent research advances that suggest that what is currently described as postpartum depression actually begins before the baby is born. And indeed, maternal mental illness is a significant public health burden and is estimated to affect 1 in 7 peripartum women, that is, both during or after they have been pregnant. So overall, it will be interesting to see how these recommendations are incorporated into routine prenatal care both in the US and, kind of watching to see if similar recommendations will appear in other countries in the next few years.
I would just like to add something here because I think this is really great progress, and that independent of in how far it is actually going to help to spot affected women, I think it will raise awareness on a national level, and it will help reduce the stigma that comes with this disease, which is still really, really strong for mothers. It will hopefully make women more able to talk about it, and maybe if this actually turns out to be a success, it would be great to see mental health screenings incorporated into primary care responsibilities and for everyone, not just for women.
I totally agree with you, Vio and Marie. I had heard that story a little bit about it, and I was a little surprised just because I wasn't familiar with the research about depression also being in pregnant women and starting at the end of their pregnancy. So I think it's a great, wonderful news that there's actually policy happening about this, and to like you said, highlight the mothers that will potentially have postpartum depression. So I think that's great. Thank you. And let me now tell everybody what the story is that I found interesting lately. Recently, actually, at the end of January, there was the first ever gathering of scientists at a meeting through the United Nations Office of Disaster Risk Reduction. And they got together to discuss disaster risk reduction and basically how science and technology play a role in it. So the outcomes of this meeting was the launch of the UNISDR, that's thereof the United Nations Disaster Risk Reduction Office, the launch of the UNISDR Science and Technology Partnership, and an approved agreement on a science and technology roadmap for the implementation of the Sendai framework. Now, the Sendai framework is a framework for disaster risk reduction, and this was adopted in March 2015, and it's supported by the United Nations. So for me, what's exciting is the fact that, one, there's a roadmap for how science and technology will play into implementation of this framework. And that, like I said, it's really important as a scientist to show that there's a role for science and technology in disasters. And some key examples that were highlighted how science and technology plays a role in disaster risk reduction and management were climate science and also emergency telecommunications. So this is, to me, this is really interesting. And the other thing that was stressed during this meeting was that there needs to be more partnerships and collaborations between the science and technology sector and also the disaster management sector. This needs to be happening in order to reduce our risk for disaster, and then when we do have disasters, mitigate the effect on the populations.
That's really great to hear, and obviously for you as a scientist, Jessica, but also thinking in terms of the implications for global health, right? We all know disasters in and of themselves could cause health crises, but especially when it's natural disasters and conflicts, that could also result in downstream health crises, especially affecting both physical and mental health for those involved in them. So a very important advancement right there.
Absolutely, Marie. I mean, you really hit the head. And, disaster is, some people think of just disaster and don't actually think about the implications for health if you're not thinking of a health disaster, but they're there. And so that's why we focus on it in global health as well. Now, Sarah, I'm excited about your update just because I'm another person that loves viruses. So tell us about what your update is going to be.
Thanks, Jess. So yellow fever is a viral disease which is transmitted by mosquitoes and can result in severe illness with bleeding, jaundice, and sometimes even death. So there is a yellow fever vaccine which is required for travel to affected areas, namely certain countries in South America and Africa. Now, a certificate confirming vaccination provided by the health professional who gave the vaccine is required to travel to these countries. Now, the vaccine used to require a booster vaccination 10 years after the initial shot. In 2013, evidence showed us that the vaccine actually confers a lifelong immunity. However, booster shots were still required to travel. From June this year, vaccination certificates will be valid for life. So for those of you who have already had the vaccine, you now have lifelong coverage. But for now, you will still need to check whether the country you are travelling to requires you to have a booster if your shot was given over 10 years ago. If they don't, and after June this year, just make sure to keep a hold on to your yellow fever certificate for any further travel.
Thanks, Sarah, for that update. I think this is a really important update for people because it's cold in a lot of areas of the world, that it's winter and people are wanting to get out. They want to go to warmer locations where actually some places may have yellow fever. So I think it's important for people to know, okay, I'm going to go on vacation. Do I need to get a yellow fever vaccine? Or if I've gotten the immunization, do I need a booster? So Sarah, tell us, where can we find information if travelers want to figure out if they need a booster or not?
Sure. So yeah, so it's definitely very cold here, so I wouldn't mind a trip to South America maybe. But the World Health Organization has an updated list on their website of which countries require you to have a booster. However, as always, it's best to consult with a travel doctor or a GP before travel, as you might require other vaccinations or malaria prophylaxis or some other medications.
Excellent. And you know, it's interesting because I was over after Christmas and into the new year, I was visiting my family in Paraguay, and this issue with yellow fever and the vaccine actually came up while I was there. I don't have a yellow fever vaccine, so I would not have needed a booster, but it's interesting seeing how this is playing out in real time, and it was real time when I was there because they're now getting people vaccinated in that country. So I think that is everything we're going to discuss with you today, unless anyone has any further comments or, anything they're like, wait a second, we didn't talk about this. But if not, I want to say thanks for watching us. Thanks for the panel being here today to give us our updates. Very interesting. And, we're going to be continue doing episodes like this. We're going to be talking about the various interesting, at least in our humble opinion, what are the interesting stories going on in global health. And yeah, so you can find out more by going to our YouTube channel, This Week in Global Health, or you can visit our website at www.twigh.com, and there's ways to get in touch with us. We've got our Twitter handles and our hashtags, so send us questions, let us know what you think. Let us know what you think we should be covering in case we're not covering it already, and we'll try to do so. So thanks again for watching, and we'll catch you later. Thanks, everybody.